part of a new day thinking on this campus. Our new name, Highlands Medical Center, will be effective today. Should you see us in the paper, should you call the telephone, should you walk in the facility, should you see any of our employees, we're now Highlands Medical Center employees. And we look forward to what all that means for us going forward. That's pretty much it.
That partnership has been consummated and agreements were finalized after a lot of hard work by many of both the Capella team and the St. Thomas team's part. We have, I'll introduce here and he'll come up, Wes Luttrell, I think I got that right. We were talking about how many ways to say it here a minute ago, and several of the St. Thomas leadership here that will share and visit and hear a little bit on their part. So what is this agreement? This agreement informs really the Capella Middle Tennessee hospitals going into a joint partnership, joint ownership and joint management agreement for our 4 hospitals here up on the plateau. The agreement also anticipates bringing in other facilities, and as we'll get into some of the notion of health reform and other things going on in the industry, we see a great opportunity. We're hearing from a number of facilities around this part of the world of interest in joining in a partnership like this. For Capella, what's the opportunity here? We've got really good hospitals serving our community. It's an opportunity to really enhance and do more and service and serve each of our communities that we're in here. The broader opportunity and kind of what's creating and what's driving a lot of these things. As you talk about, you hear a lot about you hear every day on the news what's health reform doing, what's accountable care, et cetera, et cetera. In simple form, as we think, as our Capella team talks about healthcare in this era, it's pretty straightforward. You have to provide the highest quality of service in your community, doing that while satisfying your constituents, your patient, your customer needs, and doing that while lowering costs and expanding care. And so as you talk about those things, it's from my standpoint, been in the business a bunch of years. It's probably as complex and difficult of an environment to operate in as I've seen in the 30 or so plus years that I've been in the business. And so as you think and see the opportunities, really leveraging it's organizations coming together and leveraging and with the St. Thomas group, really it's enhancing and expanding those things that they do from a tertiary standpoint. It's leveraging all those opportunities, and we do think that we'll see other facilities in this region that will be interested in this kind of partnership. Together, I will say, I know St. Thomas and Capella share the commitment to providing the highest quality service, and we do see, again, that opportunity to leverage and expand in some of those things that we're doing programmatically.
Both of our institutions have had enough conversation that our mission, vision, and values are similar in nature, and we feel like moving forward in these communities, we'll be able to do some things that help them as well as learn from Capella and you as we continue in this journey. I'd like to take just a second to introduce the people here with me from St. Thomas. Rebecca Climbers here. She's our marketing Chief Chief Marketing Officer, not Human Resources. I'm going to give you more duties. And then Tom Blankenship, Vice President for Business Development. And we've got Dr. Bill Thompson over here, our Chief Medical Officer. Again, I thank you for the opportunity for letting us be here with you today and sharing this momentous occasion. It's coming up here in just a second, and I'll turn it over to Bill Lewis. Thank you.
And Bill, we'll just play band for you.
That sounds great.
Thank you.
If I could just take a couple of moments to introduce a couple of people locally who are instrumental to us in our efforts in providing healthcare services, as well as just an important part of our community. We have our board chairperson, Craig Lynn. Carmen Ratliff is another board member. Gary Militana, Dr. Gary Militana was here. Just a second. There he is, right here, standing tall up front. And the other person, yes, sir.
Well, go ahead and do it. While you're introducing, it's probably a good idea to introduce the rest of the Capella team.
Absolutely, certainly do that. And our local sheriff, Odie Shute, is here.
Hey, your answer.
There you are in the back. So thank you for coming and celebrating this with us. In addition, Dan, you want to go ahead and introduce
Sure,
yourself?
and let me introduce, we've got several of our Capella team. Mike Wickert, not wearing the tie back there. The gentleman who's really done the most work in trying to pull this together, Mark Medley, who's our president of hospital operations. Dr. Eric Swinson is our fellow CMO, and then Beth Wright, who is VP of Communications. So this group, as we talked about this transaction, has been very involved and worked hard in trying to get things come together. So I apologize, Bill, I should have done that earlier.
And the trouble you always get into when you do this is you leave somebody off. A couple of very instrumental people for us locally as part of our medical staff as well are our physician advisor, Dr. Alan Drake, over in the corner, and then our Vice Chief of Staff, Dr. Kalyana Kumar. So thank you for coming and participating with us. I'll just get to the point. I can't say it any better than what Wes and Dan did. We're extremely excited because of the quality efforts that St. Thomas Health is known for. St. Thomas Hospital has been named a top 100 hospital in the country over 11 times, and we aspire to do that here. White County is known for doing things great, doing things in a large way, demanding excellence, and we think with this new affiliation that fits right in line with what your expectations of us as a facility are. So we're excited where this leads us going forward. As part of this whole arrangement, and as part of this new venture, we're also reinvesting in this hospital. And I guess we can start to unveil this now, but
we thought you were going to keep talking.
I'll do that. Keep talking as we do this. We're about to invest over $1 million in this facility to improve things such as emergency room services, where we can implement new processes, new lean processes that will hopefully ensure that our patients are seen in a more timely manner and have better outcomes. In addition, we're doing things such as far as the geriatric psych unit, we're doing a total renovation of that area. We're looking to do a renovation of our medical surgical floor as well. We want our patients and our staff to be able to experience the type of experience that you would expect in any hospital in the country, and we'll get that here. In addition, let's see, not that one just yet. In addition to that, we'll be expanding and renovating our new main entrance area. It will include this kind of portico area, as well as the volunteers area, the desk, the gift shop that the volunteers have.